Now, over 90% of people think menstrual health affects their working life and would welcome support policies in the workplace. That's according to a new survey by the Financial Services Union. And here to tell us more, we're joined by Mandy La Combre, who's Senior Industrial Relations Officer with the FSU. Mandy, you're very welcome to the programme.
Thanks very much. Thanks for having me.
How big? I hope I pronounced your name correctly there.
You did.
But tell me how big this study was.
Well, first of all, just to give you a bit of background, I suppose, on how we initiated it and what was involved. So during the month of March this year, to mark International Women's Day, the Financial Services Union launched a workplace survey throughout our sector. So our sector is the finance and tech sector in the Republic of Ireland and Northern Ireland. And it was really on how menstrual health impacts work and life. And I suppose from our perspective, historically, this is something that's been largely ignored in the workplace, despite the fact that it affects 50% of the workforce. There are also several specific medical conditions associated with periods, such as endometriosis and PCOS, that are impacting working women with really, really debilitating side effects. And actually 1 in 10 women in the Republic of Ireland suffer from endometriosis. So with that in mind, the fact that we have 67% female membership within our union, we also have a women's network that suggested that this was something they wanted us to have a look at. So we launched the survey, as I said, in March, and we had over 1,000 respondents to the survey and over 2,000 written comments in the comments.
Well, do you know what I found very interesting when I was reading some of the outcomes of the survey or the study? Given the dominance of males in executive positions or senior management positions in different workplaces, I found it very interesting that 49%, or just about less than half of people questioned, were not comfortable talking about menstrual health issues in work, and 69% said the reason being the gender of their manager. So no surprise in a way.
Well, not surprising then, but it's something that our members would have been discussing with us. But it was the dominant reason, I suppose, in the survey for why people said they didn't speak up. But it was only part of it. I mean, there's also the culture piece around the stigma in the workplace, around even speaking up around periods. Because, I mean, we could speak for hours about historic social taboos and gender stereotyping and how that stigmatized menstruation is something that should not be discussed in society. So that obviously spills over into the workplace as well. So that negative stigma has obviously, permeated through the workplace, and it doesn't allow people to feel confident to speak up. But the gender of the manager was the main reason and the main barrier for people not speaking up. I suppose from my own self, the biggest finding was 96% would welcome a menstrual health support policy in the workplace, and we could counteract some of that by doing that,
Yeah, and can you talk, because that was, for me as well, that's what jumped out at me, Mandy, can you talk us through what would that look like? What is a menstrual health support policy and what difference would it make?
Okay, well, having a policy in the workplace is obviously going to create a more inclusive working environment, etc. And, the ultimate goal is really to improve workers' well-being, creating an environment that, workers can be open and honest, initiate and engage discussions around periods, but also have a more comfortable and inclusive workplace and break the stigma around period health. So the kind of things, the measures we would be looking for within a policy is reasonable accommodation or special leave for medical conditions that cause painful menstrual symptoms. So, as I said, endometriosis and PCOS, etc. And that's not, us saying that we want paid time off every month for every woman who has a period. We're talking about people who have really debilitating symptoms. And it's important to include that because as part of any constructed policy, you would have a guarantee that absence related to those medical conditions wouldn't be considered in the context of triggering an attendance improvement plan or a performance improvement plan.
So would that be, you get it, would you have to go to the GP or would, No.
Well, look, we're very early days on this, okay? So, I mean, we're not calling for legislative change for period leave at this stage just yet. What we're trying to do at the minute is get employers to sit down and have conversations with us around menstrual health workplace policies. this union, the Financial Services Union, has been at the forefront of securing a lot of very progressive policies. We were the first private sector union to secure menopause workplace policies. We did a lot of research into that a number of years ago, long before others were talking about it. So we see some of the menstrual health piece as an addition to that. We would already have agreements in place with employers where we would see this piece around menstrual health would be quite easy for us, to add on as an addition. But it's around the awareness piece and the training. I think the training of people managers, specifically on medical conditions and stigma, is something that will help.
One of the things another thing that was mentioned, which I thought was really interesting, was this idea that people could work from home, for example, if they were having a very heavy period or a very painful period, or just small things really that would make a big difference to some people, a lot of people.
Well, there's an awful lot of stuff that we would put in the policy that we would say are, not onerous on employers at all. As you say, the option to work from home, people are already hybrid working. So if you had a bad period, can you not just stay home that day? Flexibility around working hours. We would have free period products provided in all the workplaces where we have good employers, where we have agreements in place anyway. So this is just an extension onto that. But in terms of even just having some kind of environmental support, you could have, ensuring your office temperature is okay, desk fans, breathable uniforms, good access to wash facilities, a couple of breaks maybe that if you could, need to take medication, etc. So they're kind of soft things that you could put in the policy that you'd be wondering why an employer would
well, maybe they do exist, Mandy. Maybe there are workplaces there who have exercised best practice here, and we'd certainly love to hear from them. To 51551, free plug as it were, for best practice. We'll leave it there for the moment, but thank you very much indeed for joining us. That's Mandy La Combre, Senior Industrial Relations Officer with the FSU.